welcome once again on behalf of RedETSA to this 50th edition of the webinar program entitled 50 Webinars of RedETSA, Networks that Transform. This is a very special edition for the network where we celebrate this 50 shared meetings. And before beginning with the topic that brings us together today, which was chosen especially for this occasion, we're going to have a small commemoration. Before that, I'm going to give you some technical instructions. We're going to have interpretation. We're going to have English and Spanish. The session is being recorded because afterwards, just like with every webinar we do in RedETSA, it's going to be available in the webpage, redetsa.org, and also in the PAHO YouTube channel. Without any further ado, Alejandro Lebrun, Interim Chief to Medicines and Sanitation Technology of the PAHO, has the floor to give us the opening words. Thank you very much, Marlene. Thank you very much to my colleagues, to all the participants and the members of the RedETSA network and guests for this special day. And today we are celebrating the 50th webinar in this program, in the RedETSA webinar program. So this is another reason to be happy today and to celebrate, especially to the Secretary of RedETSA and also the whole network. So I wanted to thank all of you for so many years of participating and collaborating in this network. And as you know, this network was created in 2011. And the first webinar that we had in this program, where we were in the 50th edition, was in 2015, where we had a webinar, and the topic was instruments to measure the quality of life by the National Institute of Cardiology in Brazil. It was the first topic that we dealt with. It's also a very important moment to thank everyone in the Secretariat. And I wanted to ask you to turn on your cameras because I think it's important for everyone to know who you are. We have Melanie Roman, Vania Canuto, Caroline Bergman, and all of these individuals work with us, and they've been working with us full-time in the Secretariat in RedETSA, and also in the webinar program that has been quite successful. And in order for it to be successful, it also has to generate a lot of work. So I wanted to celebrate and also to thank this whole team for all their effort. And apart from the team that is participating today with us and that works with utmost dedication with the Secretariat of the network, I also wanted to give a special thank to Francisco Cacao. Francisco, please turn on your camera too. And Francisco is not in our team anymore, but he continues working with us in the PAHO and other topics in other areas. But he was here since the beginning, and he was one of the pioneers, one of the fathers of this program. He was here since the origin of the program, and he coordinated the program for many years. So I just wanted to give a special thank to Francisco Barcao for participating with us. And we also have the support from different colleagues in charge of invitations, logistics, web pages. So thank you to Laura Ferrer, who's here with us, Lisette Nunez, she's been here with us many times. I'm not going to name all of the colleagues, but I don't want to forget anyone and be unfair. So I just wanted to thank everyone for all of this hard work. And I'm sure that it's worth a while to have done all of this. And this is a very important milestone. And today we are reaching this milestone of having the 50th webinar session. So it's a reason to celebrate. And I think we all agree that this is a program that generates space for exchanging and strengthening capabilities. The amount of participants has been growing with the years. Since 2015, we started with very few people, but today we have a lot more participation. We have many different members from different institutions in different regions. And wanted to remind you that these topics are suggested by the members of the network. And most of the webinars, and I don't think there has not been any exceptions. We've had many guests, but almost all webinars, we had at least one member from the network being a speaker, debating. So this shows the dynamism of our network and how much our network has grown. We have been able to build a community with this. So I'm going to stop now because we have a very nourished agenda and we started with a small delay because of technical issues. So I'm going to dive directly into sharing a video of the story of the program, of the webinars in RedETSA, not only the security team, but also Santiago, who gave us aid. He helped us on doing this video. So thank you very much for participating. And now we're going to go to the commemoration video of the 50th webinar in RedETSA.
Bueno, muchísimas gracias de nuevo, Santiago, por colaborar con este video.
Thank you again, Santiago, for this video. Unfortunately, we have another problem. We couldn't have the beautiful music we had, but well, we hope that you perceive all the diversity and the quantity of institutions and lecturers we have in our program. So we're gonna summary in this presentation some of the results of our small program of webinars. So this started in 2015. We are almost 11 years old and 50 editions, so we're going to try to comment some of the interesting aspects of these 50 seminars. So, for example, regarding the lecturers, we had 85 lecturers, very different, 103 participations of people, compound about 85 lecturers, most poor, once in their participation, but that's a big participation in the region and outside that we're able to participate in our swimmers. So this 85 people represent 44 institutions and organizations all around the world. 18 countries participated, institutions from 18 countries. So, which countries had more participations? In the Argentinian case, it was the leader, 21 participations all around those 50 seminars. And those international organizations that we cannot attribute a country, we compound from three participations in organizations like PAHO, HCI, and NAHCA, Euroscam, and World Development Bank, and yes, we can see the same thing. All the participations for all the countries, and the countries with the more were Brazil, Chile, Colombia, Ecuador, UK. We only have two countries out of the region, Spain, that we work jointly with the National Network of Assessment of Sanitary Technologies, and the UK, we have another institutions contributing a lot. Um, it's always very, very good to participate in our webinars. Institutions outside the network. So, as Alexandra said, most part of the lecturers are from our own network. Regarding the participants of the webinars, this was the own just was a sample of the last 10 webinars. We had participants from 64 countries and countries around territories around the world, and most part from our region. And most part of our region have participated in our webinars. Always we can see 95% of our participants of the region are from the Americas region. Most part of our seminars, the recipients are our own institutions. So the countries that had the most participants were Peru, Argentina, Brazil, Colombia, El Salvador, Ecuador, Honduras, Guatemala, Uruguay, Mexico, United States, Dominican Republic, Bolivia, Spain, Jamaica, Paraguay, Canada, UK, Haiti, Suriname. So, to me, four countries in our region represented in this chart showing, in fact, that 95% of our participants were from our region, but we have 64 countries that had participated. In this 50 seminars, we grab topics in different categories just to see when we were talking about, and we perceive that these webinars, uh, even we already know, we always try to shoot, but all of those are proposed directly by members and in different meetings that we had. Some others, we saw different needs and all the topics that were in fashion of different national opinion, and we want to see our opinion, and we want to offering to contribute within all the categories, and we can see that we have different topics that are convoked in these seminars. For example, we have 7 seminars that were from sanitary technologies, evaluation specific from different technologies, like, for example, 3 from medical devices, digital health, diagnosis in vitro tests, economic assessment, social and ethics, equality dimensions, evaluations, difference approach on evidence and data analysis, big data, AI, institutionalization, early alert, monitoring, investment, more methodological aspects themselves, and networks working processes, different hospitals network and problems, and those are the topics we approach in different seminaries. And you saw in all the video the titles and the lecture from all of them. Regarding the impact, what can we see in these 50 seminars with the participants? We have more than 12,000 participants in our seminaries. We can compute in all the seminaries. And with all series, we have more participants in some of them. And the one with the most was the different 2023 seminars that were about the different thresholds that we have with 500 participants, both with AI, in 2022 and 2025. And the seminar we have about promoting equality in ATS in 2025, and others involving patients and technologies and ATS for medical devices. Those were the seminars that had the more participants live and with the more reproduction. And we put it in the YouTube channel. At the same time, we put all the links in the RedETSA link, and we had all the sites. We're sharing with you just to visit the chat, and we can share that we have more than 3,000 reproductions after those webinars. And with this, sanitary and technology topics are so important because this is a very humble program, but with the repercussion, this is very important. And all these things we saw with the growth, with the growth of this continuity and all around these living years is showing all the exercise of the network and the strengthening of the ETS in our region. So, without more, thank you very much for being with us in this seminar. I'm very happy you participated, and I really thank all the lecturers that shared all of your time, your knowledge, your experience with the network. So we really thank you for being here in this space, continuing, and we want 50 more, please. And as previously commented, with these RedETSA seminars, with these 50, reflect the growth of our regional community. We're committed with the decision making based on evidence and was also this witness of this strengthening of ETS in our region. So I'm not going to interrupt more. We're going to store this thought, especially for this occasion and the network work in our region, and we're gonna try to reflect together how in this context with different needs we were developing different networks with different approaches, but that were able to respond to their own challenges in their own countries. So I'm gonna open the floor for my dear colleague Danny, and she's gonna be the moderator and of this space. Um, Morning. It's a pleasure to be here in this celebration. So we're gonna show our presentation of our national networks, but previously we're gonna have a fast presentation of Alexandra, our intern chief of access from Center Technologies of PAHO, and it's gonna be presenting out the achievements of since its creation. We are now 15 years old from in our work. So thank you, Alexandra. Thank you, Alexandra.
Se eu logo
Let me check here.
não deve estar em modo apresentação, não.
I don't know if it's in presentation mode.
Pouco a hora, tem que ser no switch, certo?
Sí, hay que cambiar.
De onde é esse switch que eu sempre me...
Creio que es ahí.
I don't remember what the switch is.
swap.
Well,
Está bien ahora?
Está
can
bien.
you see it now?
Ok,
Thank
muchas
you.
gracias. Muchas gracias
So thank you very much for
possibilidad de
this
compartilhar
possibility of
nossos
sharing
logros de la red,
our
essa
achievements
oportunidade
in our
única e
network
especial, não?
RedETSA in this special way.
Isso
So,
todos sabem, pero
well,
para
all of you
ficar aqui
know,
com
but
a
we're
informação
going
de
to start
saber, dos
with all the
objetivos,
information into
da
our network,
estrutura, não, dos
objectives, structure,
integrantes,
participants,
como na rede consolidada, e
all
vamos
members,
reconhecer
the
a nossa
consolidated
consciência,
network, and the
claro, de melhor
recognized
você
environment.
poder trabalhar com
We don't
essa
have the
rede
bias of
desde
been working with them,
15 anos,
but yes,
celebrando 15
in
anos de
15
rede,
years,
são números
celebrated
realmente
with the network. Those are very interesting
extraordinários,
numbers.
5.000
50
usuários, 15 anos
seminars, 5,000
de...
reports,
Assim
15 years
que,
after network. So
pero eu quero que todos reconheçam que temos hoje
we
um
recognize we have
reconhecimento
today
que vai
some
muito mais além da
recognition
própria região,
going
para
beyond
o sul
our
do
own region
Oriente, uma
internationally.
celebração para a
This is a
sociedade,
very
para a
interesting situation
capacidade
for their, our
da rede
members and for
consolidada.
our international consolidated
Aqui,
network.
perdão,
So
aqui os
here,
países assim, que têm
the
instituições não
countries that
necessariamente
have
representação, por exemplo, no
institutions,
sistema
not
governamental, nos
necessarily a
Estados Unidos
representation,
não há,
but in
temos
governmental institutions. In the United States, we
11
don't have
instituições
bad
membros em países
members,
emergentes,
institutions,
tivemos
countries,
crescimento impressionante
and
nesses anos,
we increased a lot
mais de duas vezes,
our
de 30
growth
para 43
twice last
instituições,
years. 33
21
institutions from
países
21
representados
countries
em meio
represented in
aos membros.
2026 in
E,
some way
e por que
with the
trabalhar em
members.
rede?
But
Não? Se não
why
fosse
to work
subregiões,
in our network? These are
o tema da
our objectives. The
institucionalização,
topic of the
de desenvolver esses processos que
institutionalization.
apoiam as
These are
decisões,
the
apoiam a
processes
colaboração
supporting
baseada em
decisions and
baseada na adoção de
incorporation
tecnologias,
based in our
facilitando a
technology. This
visibilidade
can help the
desses
visibility
processos,
with the
facilitar que
processes,
genere, generar-se
and
eficiência
it's going to
dentro dos
generate
esforços,
efficiency and
buscar
for
intercâmbio
applications, and we're
laboral
going to
entre
try to
entre
look
países,
for
não?
the
Buscando
exchange,
diversidades,
improving
intercâmbio de
collaboration
experiências,
between countries, looking
facilitar
for
acesso à
diversity in
informação, compartilhamento
experiences
de
exchange,
práticas,
opening the
ver os
information, sharing the
processos de
EMPs,
avaliação,
full
formulação de
evaluation
diretrizes
processes,
legais,
and incorporation of sanitary technologies. I
nessa
have an example from
base,
our
cada vez
base.
mais países
The
cada vez
prism
mais
every
instituições
time more
usando
countries and
em
institutions
seus
are using the
processos
base in
de
their
revisores,
processes of
de
the
evidência,
development of the evidence decisions
elaboração de
and
recomendações,
the
elaboração de
elaboration of
normas,
recommendations, incorporation of
facilitar o
technologies,
acesso
and
ao
yes,
acesso à
and
capacitação,
driving
construção
the
de
access
capacidades
to
institucionais, das
capacity
ferramentas que
building,
desarrollamos,
training, and within
e também
the
como podemos
tools to
apoiar o
develop,
processo de
and how
decisões
can we
informadas
support
por
well
evidências,
these decisions
construindo
with
informação,
evidence, with the
revirando
information generating
processos mais
a
robustos e
process
mais
which is more
mais
robust, more
credibilidade nesse
legitimacy,
processo. Então,
and with
tudo
a
isso são os
credibility. So
benefícios
all
que
of
por
those
trás
are the
trabalhamos na rede
benefits of what
a
work in the
nível
red
regional
and
e a
then
nível de
regional
países, como
level
podemos
and in
já
the
ver
country, as you're gonna
com,
see in
com,
some of the
com outras
movement,
experiências de países.
these experiences.
Algumas aqui alguns pontos muito importantes para compartilhar com
These are
você.
some very
É que
important points to share with you. And these are some of the things that we have been able to achieve so far, like strengthening different capabilities after 50 seminars. And we've already had 16 different meetings up to date, and this has been a milestone in itself. And I don't remember any other network that has been able to be so consistent in terms of on-site meetings. So I wanted to thank the government of Brazil, the Ministry of Health in Brazil, that's represented here, because I would say that 95% of the funding that we have received for maintaining the network actively, this was done because of contributions and voluntary financing coming from Brazil, from the Ministry of Health, for the Department of Management of Unitec. So I wanted to mention this before, because many of the things that we have been doing here has been possible because of this effort. and also the open and daily meetings, the presential networks. We have more than 400 people involved in this presential networks in the last 3 years. More than 300 people from 28 different countries attended to these courses. And the scholarship program had more than 207 participants from 17 countries and 4 donors. And we had the representation of them here. And also a special mention to our Argentina AJEX, who are always offering those scholarships for the members of RedETSA. And they use their own funding. And they have been also able to offer these scholarships to different countries. Also exchange programs. We have been very successful doing this with Brazil, Colombia, and Canada with different representatives. And finally, we're going to be able to do another exchange in May, in 3 weeks from now. Many institutions are going to be represented in that exchange in Spain with a Spanish network with the ICSID support. And these are recent publications for assessing hospitals. So we do have a lot to show, many results. And all members should be proud of the results that we have been able to achieve. We also have network working groups. I'm not going to dive into details here because most of you know this information. We have been working on equity, adaptation, real-world evidence, medical devices, AI, the use of AI. We also wanted to mention BRISA. As we mentioned before, we have done more than 5,000 reports with more than 11 countries who participated, and we reached more than 1 million visits on the webpage since the launch of BRISA. And this is being used more and more in the assessment processes and to generate reports in the region and also outside the region. As you know, the Spanish network has asked us, it's not that we went to talk to them, the Spanish network came to us, it came to RedETSA, so that we can host their reports in BRISA. They have more than 500 reports from the Spanish network in BRISA. And this shows the importance of this achievement. And here we have Francisco with us so that he was also part of the beginning of this process. Some other impressive results from 2023. It's relevant to mention that we had a significant growth in the amount of countries that have institutions with ETS. We went from 12 to 19 and then from 7 to 14. With a legal framework where they mentioned the ETS in our decision-making process. There are gaps, nevertheless. There's a lot to do, but the results are very important in this last few years. We also have collaboration and cooperation with other entities, other organizations, networks, international institutions. Some we have formal agreements with, others not formal, but just cooperation agreements, like NICE, INHATA, HTAI, IUD, now the Spanish network that we're going to start working with. And I would say that in most of these cases, they approached us, not the other way around. They were interested in approaching us to create models for other networks, to work with other regions.
Tenemos realmente uma inserção internacional muito importante. Assim que creio que seria isso para ser resumo muito rápido dos nossos logros.
So this is a very, very fast summary.
Muchas gracias por la atención.
Thank you very much for your attention.
Una vez más por la participación en este webinar.
And once again, thank you very much
La
for
más 130
participating in this seminar.
Gracias, Vânia.
Muchas gracias, Alexandre, por tu presentación y todos los
Thank
logros de
you,
RedETSA y de
Alexander,
todo tu
for showing
trabajo
all
desde el
the
inicio de tener
achievements
una
in
rede
RedETSA
regional
and
que
from all the
está
work
haciendo
that you've done
aí.
in order to promote this regional network.
Felicitações a todos e
Congratulations to all.
a tu também, porque lá em 2011,
In
2010, a Oi
2011,
Brasil estava em
2010,
avisa e
Brazil
pensava que era importante ter uma
thought that
rede.
it was important
E
to have
vemos que a
a
RedETSA
network,
ha logrado
and we see that RedETSA
muitos
has
esforços e muitas
been able to
capacitações e os
achieve many
países han
things
desarrollado
based on
muitíssimo
these
en esta
efforts
região com a
in the
sinergia
region.
que RedETSA produz aí para nós outros de
And
todos os
RedETSA is
países.
creating a synergy with
Felicitações,
the different
Alexandre,
countries. So
também, mas não podemos
congratulations to
olvidar
Alexander,
de
but we
seu
cannot
doce e
forget.
capaz entusiasmo.
Muchas gracias, Vânia. Muy amable de tu
Thank you
parte.
very much, Vanya.
E eu sei que não podemos seguir aí haciendo agradecimentos, pero eu não podia também deixar de registrar
Yeah.
que muito de
I know we cannot spend too much time thanking everyone, but I would like to thank you for your time as a director in Brazil for many years.
E foi o apoio que agora sigue e agradecer a Luciene que está conosco.
And this support continues to happen. But yes, I wanted to say that without Vanya's support and without the support of the institutions, it would have been very hard. We wouldn't be here today, strong as we are today,
Nós
at
vamos
least.
passar agora às experiências
Now we're going
nacionais.
to talk about
Esses
national
são diferentes
experiences.
formatos, diferentes
These are different
configurações,
formats, different
mas vocês vão ver
configurations,
que
but
também eles
you'll
são
be
muito
able to
importantes para o
see that
desenvolvimento do
networks are very
ETS
important
em
for
nos
developing
países.
ETS in the
Nosso,
countries.
nosso primeiro ponente
So our first
vai
speaker
ser Santiago Asdeu,
is going to be Santiago Asdeu.
tem uma colaboração muito forte na região com todos os
He's been
colegas e
working strongly
representando
in
a
the
rede
region,
pública
and
de
he
avaliação e metodologia
represents
de
the
terra
national
inteira,
network of the
RedETS.
network in Argentina,
Santiago
RedETSA.
é
And
estudante de
Santiago,
doutorado
he's
em
a
medicina
student and a
médico
doctorate degree
de la
in
Universidade
medicine
de Buenos
from
Aires,
the Buenos Aires
posgrado
University,
em medicina
and he
interna,
obtained a
tecnologia, economia
degree
de la salud
in
e evaluação de
technology,
tecnologias
health
de saúde.
health
Egresado de
economy
la
and health.
maestría de eficacia
He
clínica por
graduated
la
from the
Universidad de Buenos
master's
Aires,
degree
Argentina, desde sus
in the
inicios en
Buenos
el
Aires University, and
ETS del
he's been
Ministerio
in
de
the
Salud de la provincia de
Artisan
Neuquén,
network in the
en
province of
Argentina.
Neuquén
Además,
in
es
Argentina,
co-coordinador
and he
ejecutivo
has been
del
the
RedETSA.
executive coordinator of the
Entonces, en el ámbito
RedETSA.
académico, es profesor investigador de la
He's a
Universidad
researcher,
Nacional de
professor in the
Comahue,
National University of Comahue,
donde dirige el curso de
where he
posgrado de
directs the
evaluación
course
tecnología
for
y salud.
technological
Currículo
evaluation of technology.
muy grande, ¿no, Santiago? Muchas
He's
gracias
got
por
a
estar aquí
huge
con
curriculum.
nosotros
Santiago, thank you
hoy.
very much for joining us
Muchas
today.
gracias, Vania. Muchas gracias a
Thank
OpenSA
you,
y
Vanya.
Jennifer,
Thank
a
you
todo el
to the
equipo.
Pajo,
¿Se
Alexandra,
escucha
Varena,
bien?
the
¿Se ve
whole team.
bien?
Can you
¿Y
hear
se
me?
ve
Can
en
you see me?
presentación la diapositiva?
Can you see my presentation, my slideshow?
Sí.
Perfecto.
Yes.
Bueno, la idea es contar brevemente la experiencia
So I
de la
wanted
Red
to
Argentina
tell you
Pública
about
de
the
Evaluación de
Argentinian
Tecnologías
network
Sanitarias,
for
la RedETSA.
assessing
Está conformada el día de hoy por
sanitary
23
technologies.
instituciones,
This has
entre las
25
cuales hay
different
ministerios de
institutions,
salud
among where we have the
provinciales, el
Ministry of
Ministerio de
Health,
Salud de la
from
Nación,
the different provinces,
centros
also the
académicos,
national
universidades,
center,
hospitales de alta
academic centers,
complejidad y otro
hospitals,
tipo de organismos que
and
hacemos
other types
evaluación de
of
tecnologías
organisms that
sanitarias sin
do
fines de lucro.
technology assessment without
Acerca de la evolución en
non-profit
Argentina,
assessments. Regarding the
suele pasar
assessment
cuando
in
vemos diapositivas de otros
Argentina,
países que los
when
nombres
we see
raros de
slideshows
sus
from the
instituciones no
other
los
countries, we
interesan
see
tanto,
the
pero por
names
arriba de
of
la
institutions
línea
that we do
azul,
not
lo que van a ver
understand.
es la
But on the
creación de
blue line, what
RedETS
you
ahí
see
en
is the
el
creation of
2012
RedETSA in
y que se
2012,
continúa y que hasta el día
and
de hoy
that has been
articula con todos los
continuing.
que se
And
han
today,
proyectado a trabajar
it
con redes como
articulates
RedETSA,
different
con
networks like
Mercosur, con su plataforma
RedETSA,
Mercosur,
Mercosur,
con la UCETS, que fue una
with
iniciativa del
those
Ministerio de
sets,
Salud de
which
la
was an
Nación que
initiative
después se
from the Ministry
disolvió,
of Health
después
that
con
was
Conetec, que fue
ended
sufriendo
before
y se fue
afterwards, and
equivocando a lo largo
Connectec
del
that
tiempo
continues
según las
having
distintas
changes
políticas, y con el
depending on the
proyecto de
government
agencia
or
nacional que
administration, and
presentó este
also the
Estado,
national agencies
nos
that have
mostramos
not been
siempre dispuestos
concreted, and
a
we always
colaborar y
are willing
articular.
to collaborate and to work
Allá por
together.
el año 2011,
Back in
ya
2011,
varias instituciones públicas
several
hacíamos
public
evaluación de tecnologías
institutions were
sanitarias,
doing
pero cada uno por su lado,
ETS,
y centros
but
universitarios
everyone
también hay dentro de la
independently, and
red, hay
also
centros universitarios que
universities.
son
There are
colaboradores
universities
de
in the network that
OPS,
also
que
help
trabajan, por ejemplo, en
with the
selección y
PAHO.
análisis de
They were
medicamentos,
doing
listado
a
de
selection
medicamentos
analysis of the
esenciales.
drugs,
Entonces,
essential
a
drug
partir de una visión muy
assessment.
importante
So
de
based
Guillermo
on
Williams, a quien consideramos uno de los
Guillermo
padres
Williams'
del trabajo en
vision,
red
which
en
is one of the
Argentina en
fathers of
ETS,
this
empieza a
work in
convocar, a
ETS in
identificar
Argentina, he
quiénes
starts to
hacían
call and
esto
identify
en
who
el
were
país
doing this in the country, and it creates a network. And this network, if you see, was always linked to the Ministry of Health. They were the bridge, they took the decisions, and they invested the resources for this to work. And as time passed, the different changes start to occur, as it usually happens. But the nodes start to have relationships between themselves, and then these links start to become stronger. This generates more trust and a better communication. And they don't go through the central node through the network necessarily. And we have different movements in the country. And the Ministry of Health said, we're not interested in working as a network. We're going to leave. We work here in an agency. And what the network does, instead of disappearing, it modifies its rules and saying, okay, you can leave. And it continues to work with other types of relationships and modifying the rules. Sometime after a new change in the administration, the Ministry of Health in the nation comes back to work with us in the network. They started to work with us once again, but not as an additional node within the network. It's still a very important node that we continue to work with. Alexander already said why we were working as a network. I'm going to highlight some things that he probably didn't mention, like synergy, diversity, efficiency of work, cooperation. Since there are so many people, also creativity and the possibility to do peer revision, the scale, the opportunities that start to arise when there are so many nodes, legitimacy, even when an organism has a lot of legitimacy in the society, like an agency. When there are 23 organizations that say that we recommend to cover, that has a lot of importance. This carries a lot of weight at a political level. And today, technology favors this. Working as a network 20 years ago has been very hard. And since Argentina is so segmented, it's so fragmented, it has so much inequality, we think that it's very important to work as a network. Within a network like ours that has 23 different nodes, there are 253 different links between the nodes. And I'm going to show you the mathematical formula, the amount of links. These are the links between two nodes. It could be the Ministry of Health of Buenos Aires and the Pharmacology Center, the National Center in La Plata. But every person creates internal links with other people from other nodes. So this is just an example, but between these two nodes that had two different people, they articulate the links by asking information about technologies. They generate a training course. They publish a study about certain topics that were interesting for these nodes, but suddenly two people, not the nodes, say, okay, what if we apply a scholarship for developing a certain topic, and they generate a project. This is a very important step. But after time, they become friends. Regardless, you're in one ministry and I'm in the university, we're still part of the network. And this work was done, and I have a picture here with people from the network. I have many more like this, where we did this work, where each one would show the different links that exist between the people and the nodes. So you can say, I sent you the information, we did a course or a publication, but we're also friends. And that's also very important for us. At the same time, we are a network that works with other networks like HTAI, INATA, RedETSA, and we can see how powerful this is. You can see the pictures here in AutoCAD. And we also have challenges. We have to stimulate the performance of every node and its stakeholders. We have to respect differences and putting ourselves in other people's shoes. We've had a lot of political support in Mendoza. This is the first organism that was, and there's also ministries that are giving their first steps. So every node is very important, and we have to see what are the needs of each one of these nodes. And also have to differentiate them. When we have to know whether they're talking about the network, or the node, or the person, because these can become a little confusing. We have to adapt to this Argentinian pendulum, where there are pension projects that are interesting for the nation, and to call the different provinces and work together, etc. And also moments where this appears not to be that important. And that's where tensions start to arise. And we have to know how to adapt and be creative in order to ensure the financing of the network, which which is a challenge itself. We have to support the local access for node because we know that no one is accepted in their own land. And many times from the centrality of the network, we receive they ask for support from university, from ministry, or an organism, etc. We have to understand these demands and support them, and have to create local teams. It's very important for us to get out of the way. For example, when a ministry said that we need support from something, we have to solve it and we have to try and solve it. We can say, in your province, there's a university center, and I'm going to support you there.
These pictures, these are the pictures of our group, and this is it. Thank you. Thank you very much, Santiago, for your presentation and your achievements and all the support that the Red or the network gave with all the workshops, methodological manuals and guidance. And we're going to pass now to our next presentation, which is going to be Marcela Medeiros de Freitas, Brazilian Evaluations and Sanitarian Technologies in Brazil. She's licensed in pharmaceutical sciences. She has a master's in health sciences by Brazilian University. She was working at in Center of Evaluation of Sanitary Technologies in Federal District, and since 2016 is working in this platform, the Science and Technology Innovation of the Health Ministry of Brazil. From 2025, working as General Coordinator of General Strategic Management of Health Technologies, Coordinating Executive Secretary of Federal Rebrats. Thank you for your presence. Hi, Bania. Hi, everyone. Morning. Can you hear me? It's a pleasure to be here with you, and I would like to start thanking you for your invitation for this edition of the 50 seminars of the network in the representation of this network, Brazilian network of the sanitary technologies. And I would like to start with a brief overview of the development of evaluation of Brazilian technologies in health. In 2004, it started the National Policy of Science, Technology, and Innovation in Health, prioritizing the creation a national network for the technology assessment. In the next years, was creating secretaries in 2008, and the next year, 2009, they opened a call for proposal for the creation of the first centers of sanitary technologies evaluations inside Red Brass. In that year was created a national policy of sanitary technologies management. In 2011, the network was institutionalized in the health ministry, and that was the year in which was created the National Committee for the Incorporation of Sanitary Technologies for the Unique System of Health. Initially, Redbreast was just managed by Science and Technology Department, but after the decree created in 2009 was responsibility for the Department of Incorporation of Sanitary Technologies, and depending on the Secretary of Science, Technology, Innovation, acting as an executive secretary of EdTech at the BRAS. And therefore, they are trying to spread the ETS built in Brazil, connected research with the policy management, and proposing information for the decision-making process for the corporation monitoring, encouraging technologies in the context of the health, and the strategic objectives of REBRAS are aligned with the national policy of sanitary technologies management, including create and spread studies and research priority in the evaluation of these health technologies, establishing technologies that are standardized to guarantee the quality and excellence of their research results, providing a base for the corporation process for exclusion of technologies in our systems. Validate and certify the quality of all the studies performed by the networks, boosting this professional development for all the training. And from 2019, we've offered around 150 courses for training, and we qualified 15,000 professionals, including RedETSA members and other professionals and people interested in the environment of ETS. And also, we prioritize to establish mechanisms for the follow-up of new technologies, the emerging technologies for the incorporation um, throughout this work done by the coordination and the follow-up of sanitary technologies in our department. The network structure is organized by the steering committees and supporting member of the BRAS, including department from Science Secretary, Science Innovation and Technology Secretary, and with the Health Ministry and other bodies working with ETS, and other representatives for each region of Brazil in the network. Executive Secretary of RedBras is in charge of the Management Department of Incorporation of Sanitary Technologies and all the evaluation center for sanitary centers, the snacks, which are the structures gathering inside an institution, which is public or private, non-profit institutions, resources, and professionals with the technical required technology to develop, promote, and implement ETS. Currently, we count with 142 centers of sanitary technology registered in RedBras in all the region of the country, including hospital centers, universities, Department of Health institutes, and research centers. The responsibility of are branching, incorporating technical capacity for insertion of other centers and to development of actions for continued education, encouraging the coordination in all the health systems ETS encouraging processes. Once a center joins the network, it's classified in levels according to the techno-scientific knowledge of the members compounding the center. And depending of the level of the centers, they are going to be invited to collaborate with the health ministry, generated alliances with the department in the function of their interest in time availability. Those alliances are contributed directly with this work with the intake, including development of health sanitary technologies for health ministry, analysis of all these constitution requirements for conduct development of protocols and vertical guides, development of guidance for methodologies as presented and all in training courses. These alliances, in consequence, contribute to the development of the evaluation of sanitary technologies in the unique health systems, SUS of Brazil. Thank you.
Muchísimas gracias, Marcela,
Thank you
por la
very much,
presentación.
Marcela, for your
Também pelo
presentation
trabalho em
and
relatos
for
didáticos,
the
que já tem
work
muitos
in
anos
all the debates
profissional
that
e que está
it's a
muito
lot of time ago, a lot of
endereçada
years,
a
and
entender o
it's
prognóstico
very
no resgate,
interested of
principalmente nos
having
hospitais.
nuclei
Esse foi
of sanitary
a Lei
technology
Geral da Rede
development.
ano passado foi
So
pioneira
this
no
is
hospital para
the
criar
interest
núcleos de
in
evaluação
the past was to
tecnológica
have
em
the
redes
call to
institucionais.
create the
E aí
nuclei
se pôde
of
assim
the
todo
hospital technology development.
suporte
And
para o
that's
apoio
the
à
support for
Conitec,
this
Conitec
support for Canitech
Muitas
when
graças.
contract was created.
Antes de
Thank you.
apresentar
Before
o próximo
presenting
expositor,
next
queremos
lecturer, we
recordarles
would
que
like
podem
to
realizar suas
remember
perguntas
that
pela
you
caixa
can ask your
correspondente
questions on the
debaixo
box
da
of
pantalla del Zoom
QA.
em el QA,
Q&A.
questions and answer, QA. Vamos a passar agora
We're
nós
going to
daremos
pass
espaço ao terceiro exponente,
for the
que
third
é
lecturer,
representante da
which
Rede
is a
Nacional de
representative of the
Peru
National
de
Network
Evaluação de
of
Tecnologias
Peru
Sanitárias,
for the
RedETSA,
evaluation of
que vai
sanitary
ser
technology,
Victor
RedETSA,
Javier
which is going to
Soares
be Victor
Moreno.
Javier
Victor
Suarez
é médico
Moreno.
cirurgião,
Victor is surgeon
egresado da Universidade Nacional Maior de São
from the
Marcos,
Universidad
especialista em
Mayor de San
medicina de
Marcos,
enfermidades
specialist in medicine
infecciosas e
in infectious diseases and tropicals, with masters
em Public Health por el Instituto
in
de
public
Medicina
health
Tropical
by
de
the
Paris,
Tropical
Bélgica,
Medicine
durante a
Institute,
conferência de desempenho
and
recente
it's
de posgrado
performing as a
e PH também da
postgraduation
Universidade
teacher
Nacional Maior de San Marcos.
in Universidad
Universidade
San Marco. And another
paulista,
university
atualmente
recognized
recebe
in the
cargo de
country
presidente
currently
executivo do
is the
Instituto
executive president
Nacional de
of the
Saúde,
National Institute of Health,
INS,
INS,
del qual depende el Centro de Evaluación de
depending
Tecnología
the
Sanitaria
Evaluation
SETES,
Center of Sanitary
que a su
Technology
vez
Settings,
coordina la Rede Nacional
coordinating the
de
National
Peru,
Network of
RedETSA.
Peru,
Muchas gracias,
of ETS.
entonces,
Thank you.
Víctor, por estar,
Thank you,
por
Victor.
estar aquí con nosotros hoy.
Where's Victor? For having here
Buenos días,
today.
muchas gracias por la invitación.
Thank you for your
Voy a compartir
invitation.
mi pantalla.
I'm gonna share my
Creo que la pueden
screen.
ver.
Sí, ya
Can you
podemos ver.
hear?
Muchas
Can you see it?
gracias.
Yeah,
Gracias.
can.
Bien, entonces solamente para presentarles brevemente lo que es
Well,
la red de evaluación de tecnología
very
nacional
brief,
sanitaria
which
de
is the
Perú.
National Network of
Eh,
Sanitary Technologies Evaluation in Peru.
Nuestra red es, bueno, es
Our
relativamente pequeña
network,
comparada con la que ya
it's
hemos
small,
mencionado. Básicamente está
relatively
conformada
compared with
por
the
estudiantes
already
de nivel central
presented,
del Ministerio de Salud,
born with this
sistema.
institution from this
Como
National
saben, pero solo mencionar
Center
que tenemos un
of
sistema de salud
Health.
segmentado en el cual
We have
tenemos
a segmented
a la población que está
health
asegurada
system
con
with the
la red de
population which is
salud
insured
y por otro
in
lado
our
la población que
system,
está a través del
and
seguro
with
social
the other
de
population
salud.
throughout the
Con tres
social
factores
security
principales, ¿no?
in of health,
Que hay
the insurance
servicios de salud
policy. So
diferenciados por cada uno de
this
los
differentiated
sistemas que
health
mencionaba, ¿no?
system, it's
Entonces,
in all
esta
the
red de
systems
evaluación de tecnologías
mentioned.
sanitarias que
We have
está
this
conformada por múltiples
evaluation
subsistemas,
network with all the
buscamos
technologies
una articulación
with
entre
different
los profesionales del
subsystems,
sistema de
and we
salud,
want to
¿no?
have a
Comenzamos por ETS y
cross-institutional
vamos generando ahí diversos subsistemas.
evaluation
La línea de
team,
tiempo
and
viene un
this is the
poco hace
timeline
varios años, desde el año 2009, cuando se
from
crea la UNED,
2009 when
la
we
Unidad de
created
Gestión de Evidencias en
the
Salud
unit
Pública,
of the
y
management
UNAGES
of public
en
health
OMS, que era
on
enfocada
INS,
a apoyar las decisiones
and
del
they were
Ministerio de
trying to
Salud sobre la
support
gestión de evidencias
decisions
científicas
of
sobre diferentes
health
tópicos
ministry to
en
support
salud
different
pública.
topics in public
De hecho,
health.
nuestro trabajo más fuerte en ese momento
Our
fue apoyar
strongest
el programa de
work was
inmunización.
to support
Fueron
immunizations
apoyando
programs,
incorporación de nuevas
supporting the
vacunas
incorporation of new
mediante revisiones rápidas de
vaccines,
la evidencia científica,
fast review
evaluaciones
of
económicas,
scientific evidence,
incluso desarrollando
economic
programas para
evaluations,
otras
developing
enfermedades
different
como
programs
anemia,
for our public
tuberculosis,
system for
etc.
anemia,
Luego, en el año
tuberculosis.
2015,
And in
el equipo de evaluación de
2025, they
tecnologías
created
salió una
National
recomendación entre
Institute
otros
of
subsistemas que
Evaluation
les mencionaba en el
and
segmento
other
social,
subsystems of
en donde
the
abordar ya directamente
social
lo que es la
insurance.
evaluación de tecnologías
And
sanitarias
this
para
is the
medicamentos, ¿no? Y empieza a desarrollar, por
sanitary
ejemplo,
technology evaluation for
en este
medicines,
proceso de evaluación de
developing all
acuerdo
these
con el
technologies
costo que significaba para
with
ellos
different costs
el
they
consumir
had for
medicamentos
them in the consumption
de alto
of
costo.
different medicines of high
Ya en el
cost.
2019
In
está la
2019,
demanda de nuevos
they
medicamentos
have
de
the demand
incorporación
of
en
new
algunos
medicines
contratos
for the
vinculados al
incorporations to be
aseguramiento de
covered
salud
in
que
our
integran a RedETSA,
health
lo cual
insurance
afecta
creating
a tres instituciones.
RedETSA network, integrating three institutions of the public
Uno, el
center.
INS, Instituto
One, the
Nacional de Salud,
INS, National Health
el
Institute,
IES del Seguro Social,
it's from
y la Dirección
Social
General de Medicamentos
Insurance,
que está
the
asociada
General
al
Directorate of
MINSA, ¿no?
Medicines
Que es
and
la
Drugs
autoridad
of MINSA,
regulatoria de medicamentos que tiene la
regulatory
autoridad de ETS, que se
NRA for
incorporan a esta
medicines
red
are
para monitorear a
incorporating it
RedETSA.
for all those frees
Y esta
for
red
RedETSA.
catalizada
And this
básicamente
was
por el tema de las
catalyzed
enfermedades raras y huérfanas,
for
que buscaba un mecanismo para identificar los
orphan
medicamentos que podían ser
diseases to have a
coberturados
mechanism to
financieramente.
see the financial coverage.
Luego en el 2020,
Then in
se dictó el
2020,
decreto legislativo
we have a
1504
decree,
y en ese se
1504,
crea
for
el Centro de
strengthening the
Evaluación de Tecnologías en
INS,
Salud, el
and we
CETES,
create the
y a su vez se
HTA
formaliza también
Center,
la
and this
RedNetSA, digamos,
formalizes
que pasa del
the
rol de coordinador de
NETSA
la
network, and
RedNetSA
it
al
turns
CETES y
into a
INS.
coordinator.
Otro hito importante es en el
Another important
2022 cuando
milestone
se
is
dio
in
el reglamento de la Ley
2022 when
Nacional
we
del
had the
Cáncer.
rule
Que
for the
establece
National
a
Cancer
partir de
Law,
ahora lo que vamos a empezar a usar son las
uh,
evaluaciones de ETS
and we're going to
multicriterios,
start to use the
enfocándose un poquito
multi-criteria
más en la
HTAs
valoración de lo que
that
debe ser
are
cubierto
focused
por el
on the
sistema de salud.
assessment of what has
Y
to be covered by the health system.
este tema de multicriterio empieza a expandirse ya
And the
no solo a las
multi-criterion issue
enfermedades
starts to expand
raras y
to
huérfanas como
rare and orphan
la cobertura de
diseases
los
and
medicamentos
also to
para
the
el cáncer.
medical and medicine coverage for
En
cancer.
2023 se
In
publica la primera
2023,
ETS
we published the
multicriterio,
first
especialmente
multi-criterion
para lo que es
HTA
cáncer,
for
y ya luego
cancer.
en 2024 se hace el
And in
reglamento interno,
2024, we created
y
the
para el
internal
2025
rules.
ya hemos
And in 2025, we've
aprobado
already approved
en el marco de la ley de enfermedades y huérfanos y también la ley de cáncer, lo que es,
the
hemos
framework
actualizado las normas
for
de cómo
updating
realizar
norms
BTS
on how
multicriterio en
to
el país.
do multi-criterion HTA in the country.
¿Cuáles son nuestros objetivos? Promover el trabajo
What are the
colaborativo entre
objectives?
las instituciones,
Collaborative
desarrollar
work between
ETS para
institutions,
disminuir las actividades
developing
sanitarias,
HTAs
fomentar
aligned to
capacidades técnicas,
sanitation,
impulsar la
strengthen
difusión
technical
de la evidencia clínica,
capabilities,
establecer
use
alianzas
evidence,
estratégicas.
establish
Entonces,
strategic
para nuestro país es
alliances.
importante tener
It's
esta
important for a
alerta
country to
porque
have this
buscamos
information because
equilibrar
we
las
want
diferencias que hay
to balance the
entre
differences that
nuestros
exist
subsistemas.
between the
De
different
manera que lo que se aprueba
subsystems.
en un
So what
subsistema
is approved in one
no significa que
subsystem
solamente se
doesn't
centre
mean
en
that
ese
it
grupo de
can
cobertura
only
de la
focus
tecnología
on
del otro
covering
segmento de la
that
población,
segment,
no,
and the other segment of the
sino que bajo
population will
criterios
not have that coverage.
compartidos
But
podamos
the idea is to
asegurar
share
que la
criterion
cobertura
in
sea
order to
uniforme
ensure
para
that the
ambos
coverage
segmentos de
can
la
be
población.
uniform for both segments of the
También
population.
subsistemas un
And
poco más pequeños, pero que también hayan
there are
desarrollado
also
cobertura
smaller
en la
subsystems
Policía
that
Nacional,
focus
Defensa y
on
eventualmente
the
también
national
sector
police,
privado.
defense, and also the
Entonces,
private sector.
básicamente la RedETSA busca eso,
So
¿no?
basically, what the
Disminuir
network
las
is looking for
brechas
is
en el
to
acceso
reduce
a
the
los
gaps
diferentes
existing
segmentos
to
de la
accessing
población.
health from the different sectors of the population.
Esta es nuestra organización.
This is
El
our
comité ejecutivo está
organization,
formado
the
por
executive
las
committee
cabezas de
that's
cada una de las
conformed
tres
by the head of
entidades.
each one of the three
El
different
CET
entities.
del INS es el que coordina, conduce esta red.
We have the
Hay una
coordination of
secretaría
the
técnica
network by
que
the
orienta
SETs or
trabajo
INS.
técnico,
There's a
administrativo
technical
y de
secretary that
operación de la red.
focuses on
Y luego
administration
grupos temáticos que
of the
son las
network, and then
actividades
other
mesoconómicas y otro grupo
other
temático de
thematic
enfermedades
groups
raras o huérfanas.
focused on orphan
Recientemente
or
también se ha
rare
incorporado
diseases.
a
And
la
recently we
RedETSA el
also
Instituto
included
Nacional de Enfermedades
the
Neoplásicas,
National
nuestro
Institute
INRP
of
en
Neoplastic
cáncer,
Diseases,
y son parte del
RedETSA,
grupo temático de enfermedades
and this is part
oncológicas.
of the oncological diseases too.
Este es nuestro proceso actualmente.
This is our current
Tenemos una
process.
solicitud de ETS, se formula la
We have
consulta
a
PICO,
request
y
for
luego
HTA.
entramos
We ask a
a
question
lo que
called
es
PICO,
el multicriterio
and then we
propiamente,
go
¿no?
into the
Donde tiene
multi-criterion,
grandes componentes. El valor
where there are
terapéutico, que es
large
hacer la
components
valoración de
like the
eficacia,
theoretical
seguridad y
value will
nivel de
be the
certidumbre con respecto
assessments of
a avance,
uncertainty
riesgo, beneficio.
regarding the
Y luego
risk-benefit
de eso pasamos a la
ratio,
siguiente etapa,
and
que
then
es
we
hacer
go
la
to the other
evaluación
stage
del
that
valor económico
has to
y
do
de costo
with the
efectividad,
economic
y luego el
assessment,
tema del valor
cost
social a nivel
effectiveness, and also
económico de la
social
población de los
value,
pacientes.
where there is a
Luego se
participation
pasa a
from
un
the
diálogo
patients, and then we
deliberativo
go
con los
to a
actores
deliberation
relevantes
dialogue with the
para
relevant
formular la
stakeholders in order to
recomendación
formulate the
con respecto a la
recommendation
tecnología sanitaria
regarding
y
the
farmacéutica que
sanitary
va luego
or health technology
a la
that will
agencia
go then
financiadora,
to the
que aquí le
financing
llamamos el IAP,
agency
¿no? El ente
that we call
financiero
the EA.
de los seguros públicos. Entre el año 2023 y
Between
2025
2023 and
se han podido
2025,
desarrollar
we have
125
been able to
publicaciones de ETS
develop
125, de
125
las cuales el
multi-criterion
40% han
HTAs, out
sido
of which
publicaciones a favor
40%
y
have
60% son
been
negativas,
positive and
recomendaciones
60%
negativas.
have been negative.
Nuestros principales retos es
Our main
institucionalizar el
challenges will be
proceso nacional
institutionalize
de
the
ETS,
national process for HTAs,
implementar los mecanismos
implement
diferenciados de adquisición por
differentiated
parte de las
mechanisms of
tecnologías,
acquisition
que
as
son
part
estos
of the
acuerdos,
access to
¿no?
technologies. These are the
O
agreements
de beneficios que puedan tener los
of
pacientes
benefits
o precios
that the patients
diferenciados
can have, or
para poder mejorar
differential
eficiencia del
prices in order
sistema y
to
mejorar
improve
el
the
acceso a
efficiency of
estos
the
medicamentos.
system and to improve the access to these
Crear
drugs,
una ruta única para
to create a
tecnologías de alto
unique roadmap
costo.
for
Como
high
comenté
cost
antes, se abordó dos
technologies.
rutas diferentes. Uno
This
por
began with
el
two
tema del
routes. The
cáncer y
first
luego otro
one
por enfermedades
for
raras.
cancer and the first one
Estamos
for rare
actualmente usando las
diseases.
mismas
In Korean, we're
metodologías
using the
para
same
avanzar,
methodologies,
pero
trying
aún
to
así
harmonize
buscamos estas
everything. But
tecnologías de alto
in spite of
costo
this,
que
we
nos
still have
permitan,
high
que no están siendo
high cost
evaluadas en los
technologies that are
ETS,
not being
que
assessed
buscamos
with these
luego
HTAs,
estandarizar todo este
and
proceso
that we
para
want to
todas las
standardize this
tecnologías.
process for all other
Igual
technologies.
desarrollar, fortalecer las capacidades
Also, we
técnicas
have
en la
to
RedETSA, también la masa
strengthen
crítica,
technical
tenemos una alta tasa de recambio,
capabilities
por
in
lo cual
NETSA.
siempre necesitamos estar generando
We have to
nuevos
generate
profesionales
new
entrenados
professionals
para
because there's a
estas
high
áreas.
turnover rate.
Igual necesitar desarrollar alianzas estratégicas,
We have to
coordinar la
have
RedETSA
strategic
como un ente
alliances
técnico,
with an
científico,
EMEDSA, like a
independiente,
technical, scientific,
¿no?
independent entity,
Contribuir al desarrollo regional de
to
las
contribute
HTS
to
y crear esta
improve the
masa crítica que
regional
les mencionaba
HTS
para
and
que
this
piensen en
critical mass that we
economía de
mentioned in
salud
this
en salud.
HTA and health economy
Bien, eso es lo
mainly.
que
I'm sorry,
quería
but
comentar
there's
brevemente. Muchas
speaking
gracias.
too fast. This is what I want to mention. Thank you very much.
Muchísimas gracias, Dr. Vito, por
Thank
su
you very much, Dr.
presentación,
Vito,
por estar
for
con
your
nosotros hoy.
presentation and for
Me
joining
gustaría
us
de
today.
pedir para los ponentes
And I would like to
que
ask the
pueden abrir
speakers
sus
if you
cámaras
can
porque vamos a
please
pasar
turn on your
ahora a la
cameras
parte de las
because now we are
preguntas.
going to go to the Q&A
Entonces,
session.
tengo tres preguntas aqui
So I have
gravadas.
three any questions here
para hacer a ustedes.
for
Entonces, se
all
puede
of you.
abrir creio que por Rebrates quem vai a ser a resposta das
I
perguntas vai
think
ser
that
Juan
Ratas is going to
Pilar,
answer
não?
the questions.
Que é médica, tem maestria em avaliação de tecnologia
He's
sanitária,
a physician.
especialização em farmacoeconomia
He
e
has
economia da saúde.
specialization
Foi
in
assessora há muitos anos do
pharmacology.
Departamento de
She was an
Economia da
advisor on the
Saúde e
Department of
também é
Economy of Health,
diretora
and also
adjunta do
the
Departamento de Gestão e Corporação
joint
da Correia do Ministério
director.
da Saúde por muitos anos. Então, essa primeira pergunta, aí
So
creio
the
que podemos
first
seguir,
questions,
como seguimos nas apresentações, pensando para a Argentina, depois Brasil, depois
we begin with Argentina,
Peru.
then Brazil, and then
Então,
Peru.
desde sua experiência,
So based on
quais
your
han
experience,
sido os principais
what have been
benefícios
the
do
main
trabalho em
benefits
rede
of
para
working in the
fortalecer a
network for
avaliação de
strengthening
tecnologias
the
sanitárias em
assessment
seu
of
país, tanto a
um,
nível institucional
health
como
technologies in
na
your country
toma
at
de
an institutional
decisões?
level and also for the
Poderiam
decision-making
compartilhar
process?
algum
Could
exemplo
you share
concreto
some
onde a
specific
rede haja
example
generado
where the network
sinergias
has
e
generated
oportunidades
synergies
que
or
não hubieram sido
opportunities
possíveis
that
de forma
wouldn't have been
individual?
possible
Então, você passa
in an
primeiro a
individual
Santiago,
fashion? So
depois a
first,
Cora,
Santiago, you have
e
the floor,
depois a
then
doutora,
Cora,
eu não
and
sei se
then
Gisele
Dr.
também
Victoria.
vai
I don't know
responder
if
a
Giselle
pergunta.
also would like to answer the question.
Santiago,
Santiago, you have the floor.
Yo voy a dar dos ejemplos.
I'm going to
Uno que
give
fue
two
con
examples.
pandemia.
The first one was
En
during the
pandemia,
pandemic.
el
During the
coordinador en ese
pandemic,
momento
the
de Conetec a nivel
coordinator
nacional
of Conitec at a national
tuvo a
level
disposición de él 75 personas
had 75 people
que
under him
estaban,
that
diría, un
were
año y medio trabajando para él.
working for a year and a half for
Cada vez,
him
bueno,
directly,
cloroquina, suero
because they
equino,
say, okay,
plasma, y todos se
chloroquine,
ponían
equine
tremendos a trabajar día
serum,
y noche
plasma,
tratando
and we all started
de
to
dar
work on that day
recomendaciones
and
que
night in
veíamos
order
que
to
después
generate
impactaron
recommendations
realmente las
that
decisiones del Ministerio
actually
de
had
Salud a
an
nivel
impact on the
internacional.
decision-making process of the ministry.
Vimos
And
también
most of the
que
cases
las
we saw
decisiones,
that
de
the
hecho esto lo hemos
decisions,
publicado en
and we
IGTA
have
y
published this in
cada profesor lo
IFTA and
publica
also in
a
public health
nivel de las autonomías federales de cada
magazines. In terms of
provincia,
federal autonomy in
en un
every
estudio
province,
comparativo, las
in a
provincias que
comparative
formaban parte de
study, the
RedETSA
provinces that
tomaron
were part of
decisiones mucho más
RedETSA
racionales y
took more
alineadas
rational
con lo que
decisions that
proponía
were
OPS y
aligned
otros
with the
organismos
recommendations
de
from
referencia,
PAHO and
mientras que
other
las provincias que no
organisms,
estaban en
while the
RedETSA
provinces that were
incorporaron
not in
también
RedETSA
tecnologías que
incorporated
sabemos claramente que
technologies
fueron
that we
subracionales,
clearly knew that were not rational,
cloroquina, suero
like
equino y otras
ivermectin,
cosas.
equine
Así que ahí creo que hay un
serum,
ejemplo
and others.
concreto de un
So I think that
beneficio
there's
que
a
si bien el
specific
trabajo
case of a
estudiantil fue muy
benefit
importante,
of this
y después
network
es habitual
that
para
was very
nosotros
important.
en la
And it's also very
política
normal for us
sanitaria
in
argentina tener cambios
Argentina to
periódicos
have
en distintos
periodical
ministerios.
changes in
Entonces,
different
para nosotros, sin
ministries.
dar ejemplos
So,
puntuales, es
without giving a
frecuente que
specific
decir, no,
example,
cambió la
it's frequent for
gestión,
someone
ahora
to
no
say
están
that the
apoyando tanto la
management
evaluación de
changed. Now they're
tecnologías,
not
o era el
supporting the
viceministro del
assessment of
ministro
technologies
que
or
no
the
sabe muy bien para
HTAs.
qué sirve la
Now
evaluación de
there's a minister that
tecnologías, no
does
me da
not know
tantos
what
datos, me
HTAs
pueden
is
ayudar,
for.
y de
They're
golpe
not
la red
supporting me. Can you help me? And
organiza ya un
suddenly the
evento, se
network organizes an
acerca, lleva
event, a venue.
información, esto que
They
decíamos al
approach
aire,
them,
profe, desde su
okay, they give
tierra,
their information,
acerca los otros nodos de la red, como las
and they
universidades,
talk
uno va a una
about different
universidad
nodes
de
of the
peso
network. So,
local
for example, you
y
can
se
go
acercan
to
y
a
les dicen, miren, acá
university,
ustedes tienen
and
un
your person
problema muy
university, and you say,
importante,
okay,
hacemos
we have an
parcería
important
con
group
OPS.
here. They
Esas
develop
creo que son algunos ejemplos de
a task
beneficios
with
concretos
PAHO,
que
and I think
podemos
that these are
mostrar.
the type of benefits that we can show.
perfeito, Santiago. Cora?
Perfect, Santiago Cora.
Buenas tardes, agradezco
Good
la
afternoon.
oportunidad de
Thank you
estar
very much
acá con
for
personas
the
las
opportunity
quales
to
admiro muitíssimo.
address you.
Entonces, de la perspectiva do Ministério da
From the
Saúde,
perspective of the Ministry of
primeiro
Health,
grande
the
benefício,
first
eu creio
main
que
benefit,
sea
I think,
ampliar de uma maneira
is
muito
to
rápida a capacidade técnica.
broadening the technical
Hubo a
capacities in a very fast
necessidade
way.
de cumprir os
There was
plazos
a need in order to comply with the
plazos legais
legal
para as
timelines
evaluações de
for
tecnologias
the
e
HTAs or health technology assessments.
haver uma rede com NATs muito
And since
avançadas
there,
do ponto de vista de ETS foi
since
uma
network was
oportunidade
in place, it
muito
helped us
importante. Então,
a lot.
em
So
2019,
in
ha sido
2019,
hecha uma classificação de los NATs e
we had a
los
classification,
mais avançados puderam ser contratados
and the ones that were more advanced were hired,
elaborar estudos
and
para
we
a Conitec.
generated assessments for Comitech.
É uma primeira grande vantagem.
So this is the first main
Ponto de
advantage.
vista,
But
esses
from another
NATs muito
standpoint,
avançados
those
podem
NATs that
dar
are quite
apoio
advanced
muito
can give
importante na
important
elaboração de
support
guias
for the
clínicos,
elaboration of
na
clinical
elaboração
guidelines
de
and the
guias
elaboration of
metodológicos
methodological
para
guidelines in order to harmonize
a elaboração de estudos e também
the elaboration of studies.
de estudios como
In other types of studies
o de umbrales de costo-efetividade.
with
Entonces,
cost-effectiveness
hay un grupo
thresholds,
muy importante que
there's an
apoya
important
todas
group of
las
people that
iniciativas
support all of the
metodológicas y
different
técnicas
methodological
en la
initiatives, also
Conitec.
technical initiatives in Conitec.
Muchas gracias, Cora. Doutor
Thank you very much, Cora.
Sí, gracias.
Victor?
Yo creo que ha habido muchos beneficios de trabajar en red, ¿no?
Working in
la
the network
colaboración
brings many
entre las
benefits
instituciones que hemos sido
due to
parte
the
de RedETSA,
collaboration
¿no?
of different
Ejemplo,
institutions that
COVID,
have been
en
part of
Santiago,
RedETSA,
que
like the
es muy
COVID
interesante
example that you
poder ver
mentioned is
cómo
very
tanto el ITSE
interesting,
como el
because
INS
YETSI
tuvieron
and
varias
even this,
evaluaciones en ese momento
we
para poder
had
apoyar
several
la discusión.
assessments in order to support
El
the
otro beneficio
decision-making
importante
process.
como sistema
Another
de salud
important
creo que
benefit as a
es
health
que hemos
system,
ido
I think
contribuyendo
that
a cerrar las
we've been able to
brechas.
contribute
Como
to
inicio,
closing
tenemos
gaps.
dos grandes
As I
subsistemas, el
mentioned
Seguro
before, we have
Social, que
two
tiene una
subsystems, the
tercera
Social
parte de la
Security system that
población,
has 1/3 of
y el
the
sistema
population, and
de público, digamos, en donde
the
están
public
las otras dos
system,
terceras partes.
where
Entonces,
the other two
cuando una agencia te da
parts
una
are
evaluada para
in.
un subsistema,
When
las
an
decisiones de
agency made an
cobertura
assessment for one
consideradas para
substance, the
ese
coverage
subsistema, pero no
systems
eran extensibles al resto
were not
de la población peruana.
extended to the rest of the
Cuando creamos
Peruvian
RedETSA,
population. When we
lo que
created
logramos fue que
RedETSA,
las evaluaciones y las
we were
recomendaciones
able
sean
for the
compartidas
assessments
y
and
válidas
recommendations to
para
be
todo el
shared
sistema de salud,
for the
de
whole
manera que
health
vamos cerrando
system.
las brechas
So we start
de
to close
acceso a
gaps
las diferentes tecnologías que
for
una sola
accessing different
evaluación sin
technologies
impactar
that
en el otro
one
no puede
entity assessed
hacer.
without affecting the other part of the
Esta
population.
ganancia.
So that's part of the importance of the
Gracias, doutor
RedETSA.
Vitor.
Thank you,
Entonces,
Dr.
además de
Victor.
evaluar el resultado del trabajo
Apart
de
from
rede,
assessing,
por supuesto, ustedes tienen desafíos, ¿no?
you also have
Desafíos de
challenges
articulación e institucionalización.
like articulation
La
and
próxima pregunta, ¿cuáles
institutionalization. The
son los
next question
principales
is, what are
desafíos
the
que
main
enfrentan en
challenges
la articulación
that
entre
you face in the
instituciones,
articulation
nodos y la
between
propia red,
institutions, nodes,
especialmente
and the
en su
network,
vínculo
especially
con los
in
gobiernos
its link
en
with
la
their governments
institucionalización de la evaluación de
and
tecnologías
the
sanitarias en sus sistemas de
HTA
salud?
systems in your health
Santiago.
systems? Santiago?
Sí, yo creo que principalmente es con el gobierno nacional, con los cambios que les comentaba que suelen ser tan
Basically,
radicales en
changes
Argentina. Creo que es importante
pushed
siempre,
by the national government. I think it's
ha terminado
important to
ocurriendo, pero
always,
que cada
this
gobierno
all
entienda
happens,
que
but
la
every
red no
government
es una
should understand
amenaza,
that
que
the
no,
network
no
is
es
not a
algo que
threat.
viene a poner en
It's
riesgo, a
not coming
deslegitimar
to
el proyecto que desde el Ejecutivo Nacional se quiera poner en práctica y de hecho con
um,
todos los gobiernos hemos podido trabajar muy
create
bien. Pero
constraints.
siempre hay al inicio
We've been
alguna
able
cuestión de
to work together,
desconfianza,
but
de
there's
a ver si
lack of
ellos van a hacer
trust.
algo que nosotros queremos hacer,
They
si
might
hay
think
que
that
tratar de
we,
desmerilarlo.
um,
Eso creo que es un gran
I
desafío
think that
y
this
sería
is a
muy
big
bueno como,
challenge,
bueno,
and it
por
will
ejemplo,
be.
fue en Brasil que queda creado por
It's like
decreto, por ejemplo, que eso se
Brazil
sostenga,
has
porque también en
created something by
Argentina
decree,
que algo esté
because in
creado por decreto
Argentina, for
lo pueden
something to
cambiar
be created as a
tranquilamente en poco
decree
tiempo.
can be
Entonces,
changed
creo que ese sería
in no
un desafío
time. So I
principal,
think that
digamos, que
will
cada
be
gobierno
the
vea
main thing.
la
Every government
importancia del
should
trabajo en
see the
red,
importance of the work of
independientemente
the
del
networks,
proyecto propio que
regardless of
traiga
the
el Ministerio de
projects that
Salud
they
o
have
Educación,
within
porque
their
nosotros,
ministries of health.
bueno, en algún momento que hemos hecho análisis, cuando se armó la Comisión Nacional,
When
la
we
red
created the
fue
National
el
Commission, the
organismo que más
network was
informes
the
hizo
organism that
para
more
la Comisión
reports
Nacional de Evaluación de
publicated
Tecnologías,
for
incluso cuando ellos no tenían
the national HTA
instrumentada una
system,
forma
even when they
de pagar
didn't
honorarios.
have a
Entonces,
way to
gratuitamente
pay
poníamos a disposición
fees.
recursos de todo el país para
We
ayudar.
would
Y
give
lo mismo
resources from
haremos
the
con el
country
proyecto que
freely to
surja.
help. And the same thing will happen with any other
Gracias,
project.
Santiago. Cora.
Thank you, Santiago Cora.
Lo escuchamos, Cora. Está
Sí,
muteado.
sí, como Santiago ha dito,
Just like
hay
Santiago
problema
said,
muito grande
there's
porque
a big
a
issue
rede é
here because
financiada por
the
conta do
network is
Ministério da
financed by
Saúde.
the Ministry of
E,
Health.
por lado, isso é bueno, porque há alguma
And that's good on the one
sustentabilidade,
side because there's
pero
sustainability.
há uma
But on the other
dependência
hand,
por parte de las decisiones gubernamentales.
government
Entonces,
decisions,
em
we
2019,
depend on government
hubo
decisions. So in
decreto
2019, there was
presidencial
a decree from the
que,
presidents.
como digo, havia uma decisão de
We
eliminar
had
os
a decision to
comitês
eliminate
que não
those
tinham
committees
justificado
that
pela relevância
was not
técnica,
justified
e
for
isso
the
foi grande
technical
problema.
relevance, and that was
Então,
a big problem.
dizer
So
que há uma
I think
necessidade
that
de
we
los
have a
datos
need of
buscarem localmente alguns outros
looking
recursos
locally different resources
caminhar
and
hacia a
walking
independência
toward the
propia financeira
independence
do
financially
governo
for the
federal.
government, for the
Eu creio que
federal
esse é
government. So
grande desafio
that's a big challenge.
em Rebrates.
in regrets. In terms of articulation integration, we had a big advancement with all those data. When we did the categorizations, the different CV on three different axes, we had a certain gap regarding the elaboration of the economical studies. So, the most advanced ones is sorry to support the, the others in the elaboration of the economical study. On the ETS study, ones somebody this the scientific efficacy, others economical studies. And this network amplified the technical capacity, and I think that was just a big advancement in regrets.
Gracias, Cora. Vitor?
Thank you, Cora.
Sí,
Victor.
bueno, desafíos hay
Yo,
varios. Uno
challenges we had several.
poder estandarizar
One,
metodologías
to
dentro del
standardize
network.
methodologies in the
Ha sido un
network.
trabajo muy fuerte entre
It was
todas
a
las
very
agencias que forman parte de
strong
RedETSA, poder
work in all the
establecer
RedETSA
metodológicas
agencies to
que
consolidate and
colaboren
establish a
de
methodological
manera
framework to
transversal
work
para las
together.
recomendaciones finales que salgan
So
de
these
cada
final
informe
recommendations
independiente que
from
emita el
each
GOA
report
puedan
independently
ser
from which
válidas para
agency it's
todos los
coming,
sistemas de salud
it could
peruanos,
be
no
valid
solamente
for all the
algunos
Peruvian
subsistemas.
health system, not only
Un
for
trabajo
a
muy
single
importante.
subsystem. This is
El
in a
segundo
strong
desafío que
work.
representamos para
But the second
adelante es
challenge we have
mejorar la articulación con otros
now on
actores
is
de
to
la industria
improve
farmacéutica,
articulation with the other
así
actor, pharmaceutical,
de manera que podamos hacer
pharmaceutical
más plena la participación de los
industry to
pacientes, poder aplicar el
increase
sentido de las
participation of the
especificaciones de nivel
patients,
sanitario e incorporarlas en el
improvement in the
proceso.
sense of the
Y con esta
sanitary
farmacéutica
technology, and
transportar también
incorporating the process, and with this scientific
desarrollar
information to make more
específicamente
transparent
las
how
recomendaciones.
this
Y
process is
vamos a trabajar
developed
en
and how we improve the
separar lo que
accommodations
es la
and
salud
to
individual de la salud
separate
colectivo, ¿no?
the
Está
collective
efectuándose
health from the individual
la
health
recomendación de la ETS a
because
través
they
de
are
la
following the
metodología
recommendation
compartida,
of a
donde lo
single
que la ETS
institute
pretende
of a
hacer es
patients, but the
formular recomendaciones para
endpoint
cobertura
is
en
to
el que se espera
generate
claramente
recommendations
todas
from
las personas
coverage of interesting technologies for a single group
y
needing
ese es
this
el desafío
technology,
para
not for
adelante
an
para
individual. This is a
RedETSA.
challenge we are working as a country.
Gracias. Y mi última
Thank you.
pregunta
And my last question is
el
about
futuro, não?
the
Então,
future.
mirando hacia adelante,
So,
que
looking
barreiras ou riesgo poderiam limitar a
up front, which
sustentabilidade ou
barriers
impacto
could
de
limit
sujeitos e que
sustainability of the
condições considera
packed out
clave
the networks,
para
and which
fortalecer
conditions do you
seu rol
think
no
are
sistema
the
de
key
saúde? Já
to
falaram um
strengthen
pouquinho sobre isso,
health
mas
systems?
se
You
podem
already spoke about
mencionar.
that, but you can
Muy
share something
brevemente, y
more.
después por ahí le doy la palabra a
Well,
Jorgelina
we're
para que
brief,
agregue.
and then George and Lina, but
Como co-coordinadora, creo que
as
tomando lo que
coordinator,
menciona Cora, el tema del
well,
financiamiento para la sustentabilidad es
all
importante,
the
es un
financial
desafío.
part for
Nosotros en
sustainability
varios
is very
momentos,
important. The
obviamente
funding.
alguna experiencia en
In
Congress,
different
alguna
moments, we
conferencia con
saw
Redbras,
in other
nosotros éramos
experiences in
4 días
congresses of Red
millones de
Bras,
brasileros hablar de
when
nuevas
we
tecnologías,
gather a million of
unas ganas
Brazilians
tremendas, pero de
speaking
golpe,
about
si nos hubiera
new
pasado en
technologies,
Escaramanchis,
but
Argentina, eso en
if
algunos
we had
sentidos,
an
en un
Argentina
cambio de
scale
gestión, si bien
meeting,
podíamos
and
tomar
a
parte del Estado Nacional,
change of the
hubiéramos
management
desaparecido.
depended of the
Entonces esa
national state,
tensión
we could be
entre
disappearing.
mucho más
So that
apoyo,
tension
estando
in
totalmente
more
alineados y
support
dependientes del
aligned
Ejecutivo Nacional,
completely
pero con
from
riesgos de
and
sustentabilidad
the
a lo largo del
national
tiempo, por todos los cambios
executive
políticos
branch,
que sufren nuestros
and
países.
with all the
Ese es un gran
political
desafío
problems
que
of
nos ha
our
llevado
countries,
muchas
that's a
veces a
big
discutir
challenges that took us
gestionar
to
una personería
discuss if
jurídica,
manage
los mecanismos, como mencionaba Cora,
ombudsman
de
office
incorporar
to
financiamiento.
incorporate
Creo que esas son
financially.
barreras
So those
importantes.
are important
Y otra
barriers.
agregada es
Another
el
additional
federalismo y
in this
autonomía, las
federalism
grandes
and
asimetrías
fundamental
que vamos
tensions, the
teniendo, que ya
big
tenemos de antes, pero
asymmetries
se dan entre
that we had from
provincias,
before
algunas
because we are
incluso entre
having
provincias hoy con muchos ingresos
province
por
and
hidrocarburos,
different
etcétera,
regions
y otras
for
con
different
realidades económicas mucho más desafiantes.
hydrocarbons and
Esos
different
son grandes
efficiencies.
desafíos donde la
So
red tiene
those are
que
big challenges
actuar.
where the
Le doy la
network
palabra a
needs
vos.
to be. So, George.
Gracias. Buenas
Buenos días a todos. Muchas gracias, Tao, por excelentes las presentaciones.
Those are
El
excellent
caso
presentations,
nuestro de
Georgelina.
RedETSA, además,
Um,
el proceso ha hecho que
this
debamos
process
asumir justo lo que acaba de mencionar Santiago, el caso que
assume
Argentina es un país federal y
Argentina
cuenta
is a
con
federal
24
country
casos
with
por gobierno,
24
entonces esa
different provinces
volatilidad
that we
política se produce
and
no solo en el caso nacional, sino
volatility in
también
all
en
the
el caso
politics. So
internacional.
in the
También es un país
44
muy extenso.
jurisdictions, so it's a
No
very
nos
big
comparamos con
country.
Brasil, pero bueno,
We
es
don't
muy
compare
extenso.
with
Hay
Brazil
muchas
when we have
comunidades
a very big
distintas,
extension and
hay
we have
diversidad de
different
culturas, diversidad de
cultures,
actores,
diversity of
entonces eso
cultures and
también nos toca
stakeholders.
ver
So,
y también como todo país
and with all
sufrimos
different countries, the
las decisiones
centralism
centrales, que eso sucede y es
with
bueno que así
the
sea,
capitals
empuja hacia la mejora, pero a veces
going
también
for the improvement,
lleva
but
a que en algunos
it's taking
lugares
some
del país
others
estén al menos
places
tengan procesos más lentos.
to be
Entonces,
in
la plata tiene
different slow
que
processes.
sublimar
So
todo
this
eso
needs to
en la
sublimate
financiación
all of that.
primaria.
That
Por
was
eso
a
ayudó a
very
Red Edge
interesting
en ese
experience
sentido.
in
Gracias.
that sense. Thank you.
Gracias, Rogelina.
Thank you, Georgelina. Cora.
Entonces, desafios e
Well,
riscos
challenges
são
and risk
muitos.
are a lot.
Alguns NATs empeçaram a
Some might
trabalhar para
sort
outros
to
setores
work with other
para
sectors
diminuir a
to
dependência,
decrease
e isso
dependency,
criou
and
problema
that
de
created a problem
interesse,
of a
porque começaram a
conflict
trabalhar
of
para as
interest because the
indústrias
sorting working for
farmacêuticas,
a pharmaceutical
laboratórios,
industry,
e também trabalham para
elaborating studies and also working
bibliotecas.
to connect.
É
So that
grande problema
that's a big problem.
creio que esse é
And I think
risco
that could be a risk
até para a qualidade
for the quality
evolução, não sei se é exatamente essa palavra, de los estudios que são
and all those
dados
evaluation for the studies
para conectar.
done to connect,
Entonces,
to contact.
outra questão,
Another issue here,
todo tempo há programas
every time we
de
have
formação e
programs
capacitação de pessoas
for training
senatos menos involucrados, menos
in technical
avançados
affairs
em
and
ETS, e
advanced
quando as
topics on
pessoas estão
ATS, and when people
muito experientes,
are very
são contratadas por
experienced, they
outros
are hired
serviços e
with
iniciamos
for
todo
other services, and we
novamente.
start all
Então,
over again. So
constante,
that's a constant
há uma necessidade constante e
need
permanente de
to
treinar, capacitar,
train,
e todo isso tem há custo
and
muito grande,
we have a high
são
cost
recursos que
because
precisam
those are
ser muito
resources that
bem
need to be very well
investidos,
executed and invested.
treinar pessoas que não se fijam nos
And
serviços
we
públicos
need
é sempre
people,
muito
and when you don't have people fixating
reto,
public
desafio muito
services and
grande.
utilities is very hard
Já he falado de outras
challenges.
questões, então
So we've
creio que
spoken a lot
são
of questions now, so I think those were the most important points that I have now. Thank you, Cara. Victor.
Sí, creo que compartimos
Yeah, the
gran
thing that
parte de lo
we
que se ha
share
expresado, ¿no?
a lot of
Uno
the
es
things spoken.
el desarrollo de una masa crítica de
We
metodólogos
need
para
a
el
critical
desarrollo de
mass of
ATS, ¿no? Últimamente
methodologists
estamos igual formando
and
nuevos
ATS
profesionales
create a new
con una alta
professional
tasa de recambio,
because we have a high rate of
que luego
turnover
migran a
and
otros espacios
they
donde
are
laborar
migrating
en las
to other
universidades o la misma industria
working
en su momento.
spaces for as
Y esto trae
universities and
diversos
industries.
problemas
This is linked for
con
other
respecto al
problems
presupuesto,
as
que
the
a veces es
budget,
ondulante. A veces
which
podemos
is
pedir el
undulating.
presupuesto necesario para
We
poder hacer
can
un
have
equipamiento y de repente
necessary
sucede una
budget
crisis
for our
y
equipments, but
no se da.
then we have some crisis and
Eso
that is not gonna
también es una
happen.
cuestión
So
política, ¿no?
we need
El Perú es
also
conocido
political
por la inestabilidad política que ha tenido en los últimos 10 años.
stability
Y eso
because
tiene
in the last year we
pocas
didn't have it, and
instituciones
that affects
mantienen
how the
un nivel de
institution
trabajo a lo largo
maintain
del tiempo.
a work
El tener
scheme
RedETSA y tener
throughout the
equipos
time.
normativos en ese aspecto y
Having
también la
regulatory
participación de la
frameworks
sociedad
and the
civil,
participation of
esos han hecho
civil
que a pesar de
society
todo
that made
la RENESA haya podido continuar
that
con su trabajo.
this
En algunos
network
sentidos ha podido
continued
mantener
with
a
their
sus
job.
empleados, ¿no?
until this date. So for the sustainability, we still need to keep empowering all the needs to have scientific evidence as a necessary element for the decision making, and that can ensure that the continuity of these services guarantee this budget sustainability and human resources keep working on this. Thank you.
Muchas gracias, Vitor. Tenemos
Thank you,
muchas
Victor.
perguntas, não
We
aceitamos
have a lot
todas
of
sem
questions.
dúvida.
It's not going to be
Então, se
possible to
depois, creio
ask
que
all
os
of them.
ponentes aí podem
So
responder,
then,
pero
after
muito
this,
breve, muito
lecturers are going to
rápido.
be the
A
answering, but
Brasil, aí, Cora, creio que
for
pode
Brazil,
falar muito rápido. Então,
Cora speaks very fast, but who participated in the decision of funding new sensor technologies? And do you use this network for the decision making and public funding? To Brazil also.
Não, já estava aqui, creio que Marcela já respondido. Então, vocês
I
podemos
think that Marcelo already
passar.
answers, so
Graças, graças. Só essa que é muito, muito rápido. Graças.
just that which is very fast.
Bom, depois que
After
RedETSA evalua
Contact
os
evaluates
estudos
studies
assim uma recomendação favorável ou não,
with the
aí outra
recommendation,
instância
which is
que
favorable.
se decide em que nível
And we
de
have an
governo,
instance
qual
who decide in
nível de
which
governo
government level it's going to be
financiará a
working and how it's going to
Em
be
geral,
funding the technology. In
a
general,
principal tecnologia
the
evaluada é
main technology evaluated
e sempre,
is the
a gran
medicines,
maioria
and
do
always
governo
the
federal
biggest
que
part is the
produz
federal
isso.
government
Então,
doing that.
há
So
essa instância, essa
we have
reunião
that
entre
instance, that meeting
União, estados e municípios, pero em
from
termos de
states and
financiamento de
municipalities, but in
medicamentos,
terms
sempre
of funding medicines,
governo
always
federal.
it's a federal
Ao
funding,
menos os medicamentos de alto
uh,
custo.
at least the high cost medicines.
Se estou entendendo bem a pergunta, é
If
sobre
I'm understanding properly,
para orientar a
yes,
decisão de
we're speaking
recomendação
about the
para
tools to
grande
drive these
poderia
tools up
ser
for the evaluation of
delas.
contact.
Em
Well, this is one of them.
há algumas
And in
dimensões que
fact,
colocam
actually, we have some
discute,
dimensions
pero
that
não há
competes
instrumento
discussing, but we don't have an instrument
bem estruturado para que
well
os
structured for
puedan
the members to be
seguir
able
a
to
mesma
keep
metodologia,
following the same
cada
methodology.
hace
Each
su
one is
recomendação, su
doing
voto
their
e
own
não há
recommendations and their votes. They don't have
implementação estruturada.
a
E a
well-structured
outra
tool.
pergunta, Vânia?
And what was the other question?
A outra, Marcela já respondido.
Ok. Não sei se
The other was already answered by Marcelo.
respostas são
I don't know if my answers are
Perfeito.
good. Perfect.
Graças, Santiago, que também já
Thank you,
contestado
Santiago, for answering
parte de perguntas. E aí
in
tem
these
só duas
QA
questões
questions,
que
and we have
respondida, que é
two
para
more
Peru.
that were answered
Qual é a
for
cobertura
Peru,
em termos de
which is
população
the
do setor da
coverage in
saúde
terms
pública no Brasil.
of
Tenho entendido que há múltiplo porcentagem desse setor
public health
privado.
percentage
Colaboram de alguma
in the
maneira
public
com esse
sector. So
setor
do you
e
collaborate
também se
with those
e-saúde
sectors?
e
And
INS têm
in
desafios
health on
sobre
INS,
essa
do you have
coordenação.
institutional challenges in the coordination?
Sí, gracias.
Yes.
Perú, lo
In
que es el
Peru,
sector privado, o sea, de la
for
seguridad
private
ocupa
sector,
alrededor del 5%.
or even around
Hay
5%.
una ley que,
We have a
por
law
ejemplo, tenemos un gran seguro que es el seguro
and we have a good
público de
insurance,
salud, digamos,
which
el
is the
Ministerio
comprehensive
de Salud propiamente dicho, que
health
cubre casi una cuarta de la
insurance in the
población.
health
Luego
ministry
tenemos el
covering
seguro social, que
2/3 of
cubre
the population, and then
la tercera
we have
parte, y luego unos
social
seguros nacionales
insurance
públicos,
to
y luego
1/3
viene el
with
seguro
the
privado,
smaller
que es
public
alrededor del
sectors and the
5%.
private, which is
Hay una ley
5%.
además que dice que
We
si
have
una
an additional
persona
law
tiene
that says
algún
that if
tipo de
a
seguro,
person
va a
doesn't
estar
have
afiliada al
any
Seguro Integral de Salud.
insurance, it's going to
Entonces,
be
teóricamente, toda
enrolled
la población peruana
in
tendría algún tipo
the
de seguro,
general system of
lo
health.
cual no
So
significa que no haya gasto de bolsillo, ¿no?
everyone
En Perú el gasto de
has
bolsillo
it,
está alrededor
but we
del
have
23%,
some
¿no? A pesar
costs,
del
22 and
presupuesto de salud.
3%, even when this
Sobre la
is
perspectiva
health
de
insurance. And with
coordinación,
regarding the
sí, bueno,
challenges of the coordination,
es
we are
hemos,
different
hemos creado
institutions and
espacios de
we
coordinación. El
created these
Ministerio de Salud
coordination
tejió los,
spaces, and
los
RedETSA
juntó a todos, digamos,
was the
y
one
el
coordinating all of them.
medicamento
And the first discussion fundamentally was the topic has to evaluate and establish a methodological framework that help us to share experiences and to develop those topics. And currently, our collaboration is very good. Of course, we need to go in different stability for the institutions, but the network we keep working.
Muitíssimas graças a todos os ponentes.
Thank you very much to all the speakers.
Malém aqui nos pede que abram a câmera
Malin is
todos
asking
para
us
sacar uma
to
foto.
turn on our
E
cameras in
depois,
order to take a
Alexandre
picture,
vai
and
ser
after that, Alexander is
agradecimento.
going to do the closure
Gostaria
and
de
going
agradecer
to
todas mais de
thank the
150
attendees.
pessoas que
And I would like to
estiveram
thank the
cá
150 people who were here with us today, connected in this celebration of the 50th webinar in celebrating RedETSA.
Todos lindos.
Everyone's looking nice.
Podemos sacar a foto.
So now we can take the picture.
Perfecto, Baño, gracias.
Muy
Perfecto,
bien, muy
gracias.
bien. Perfecto.
Tenemos como abrir-la, creio que não é possível, vou pedir algo impossível. Não é como abrir as câmeras de todos os participantes, não?
I'm going to ask for something possible.
No.
I'm not sure, but can everyone turn on their cameras? Can we see the participants? No, unfortunately, we cannot do that. Only the panelists can be
Hubiera sido algo lindo, sí.
seen. But it would have been
Entonces,
a nice
Alexandre, Malém, não sei.
thing to have the picture of all the attendees.
Muy bien, bien, entonces...
Very well. So, first of all, I would like to congratulate Maria Bene for her moderation. I thought we weren't going to be able to finish in time, but we have done it. Thank you very much. And I would like to thank everyone once again. I'm going to try and be short. We had 150 people connected to celebrate this moment, this milestone, 50th webinar. Excellent presentations.
Novidades aí de cada rede, realmente são logros muito importantes, muito importantes.
Every network has had very important achievements, even though they're very different. They've achieved a lot, and they brought incredible cases that other regions can learn from. And we can learn how other countries are organizing themselves in different ways, taking different routes, but with the same objectives in mind. And they want to strengthen capabilities, support the system, to have more transparency, to have more legitimacy in our processes, to look for synergies. And all of these networks have been able to do this in their own way. And they've done this based on their specificities and their characteristics. But they have been successful experiences nevertheless. And thank you very much for sharing your experiences in every country. And I'm quite excited because we've been doing this for many years. We've been working for many years now.
20 anos, como celebrei recentemente de matrimônio, assim, essas fechas assim simbólicas.
So this is an important day, just like whenever you're married for 20 years with your wife. All these moments make us reflect, makes us think about the different paths that we are transiting. And I'm very happy with the roadmap that RedETSA is following. This is not only a network to have a professional exchange. We also have a lot of human warmth. We have a friendship after so many years of working together. And you can see this whenever we meet face to face. And all these human bonds are also very important. And this helps us to improve our professional relationships as representatives that we are from the different institutions that are part of the network. And this is a network that we build upon day after day. And we do this with a lot of generosity because it's something that we do voluntarily.
as pessoas, os membros e aqueles que estão representando cada instituição membro da rede, não estão ganhando para
because the members of this network
o tempo que estão dedicando
aren't
RedETSA,
earning something,
para
anything
Peru,
for their
Equador,
personal
ou
gains.
RedETSA ou RedETSA, estão sendo porque creem
You're all doing this because you
que
believe,
temos modelo
because you
que devemos
believe
seguir,
that this is the model that we have to follow.
colaborativo,
It's a collaborative model
cooperação, modelo acima,
where we
acima de tudo,
cooperate,
de solidariedade.
that it focuses on solidarity to improve the health of our people. So I'm going to stop here. Thank you very much for everything, for the presentation, for your dedication, the whole team. Thank you very much. And I wanted to say that that our next webinar
rapidamente minhas palavras aqui que minha equipe foi preparado com tanto carinho.
É dia 8 de
Próximo
maio.
webinário estou chegando.
É dia 8 de maio.
8 de maio sobre
the next seminar is going to be May 8th about the agreements for risk share, share risk, I'm sorry.
Muito interessante, número 51. Muitíssimas graças, excelente fim de semana.
Thank you very much. Have an excellent weekend with your families.
Tchau, tchau.
Gracias.
Bye.
Gracias a todos. Buen fin de semana. Chao.
Gracias a
Chao,
todos.
hasta luego. Gracias.